Trigeminal neuralgia is pain in the distribution of the trigeminal nerve. The trigeminal nerve allows us to feel our face. It has three branches, one that goes right above the eye, one that goes in between the eye and the mouth, and one that goes under the mouth. Sometimes dental issues can masquerade like trigeminal neuralgia. You want to make sure it's not the teeth that are an issue. But the reverse is also very frequently true, where patients have trigeminal neuralgia and they firstly see their dentist. Trigeminal neuralgia is where the pain fibers within that nerve are confused with some of the other fibers. The only way that our brain knows what's happening in the face is what kind of signals make it back. And the nerve is the conduit for those signals. And if there's anything that makes these signals transfer from the other fibers to the pain fibers, the brain is going to think that there's something really bad happening on the face. So our goal is to try and get that communication to stop. People that have classic trigeminal neuralgia usually do quite well, even just for a little bit, when they first take medications that affect nerve pain. When patients come to us with this kind of pain, we know that we can have a surgical treatment for them. If there's a vessel pushing on the nerve, one of the best options is microvascular decompression, when we make a minimally invasive procedure with an edge incision right behind the ear. We go and separate that artery or vein from the nerve. And usually that would lead to a very predictable resolution of the pain that's usually long-lasting. When we don't see compression of the nerve, usually we can't perform microvascular decompression, but rather what we call a lesional procedure. One of the forms is an injection right next to the angle of the mouth, but we actually go with a needle through a little opening in the base of the skull and into a particular area of the nerve that's called a trigeminal ganglion. And we inject a medication called glycerol. And that causes a very small damage to the nerve. It pushes it into trying to repair itself. That process can actually lead to the pain going away. But if there's no artery or vein pushing on the nerve, then there's something intrinsic within the nerve that causes the signals to be mixed. Giving radiation to the nerve, for example, gamma knife radiosurgery, creates some damage and inflammation, and by forcing the nerve into regeneration, usually this pain will go away. When patients have pain that continues, almost like a toothache, that's usually not pain that can be treated surgically. They have what we call atypical trigeminal neuralgia. UPMC has a rich history with the treatment of trigeminal neuralgia. Over the course of the years, more than 20,000 patients that were treated. So our cranial nerve program offers the full gamut of the treatment for trigeminal neuralgia, but also the treatment of the atypical component of trigeminal neuralgia to make sure that every patient is taken care of, whether it's surgical or not.